Talking about the Affordable Care Act, known as Obamacare, and the Trump administration's efforts to repeal it and replace it. And we have the former Lieutenant Governor of New York State, Betsy McCoy, who's also written the book, Beating Obamacare, and James Talon is president of the United Hospital Fund of New York. Let's continue the conversation. Betsy, you told us before that you had a long conversation with Trump.
He did. He called me on the phone as I was sitting at my computer writing one of my columns, healthcare columns, and he said to me, I made a promise to protect people with pre-existing conditions. What's the best way to do it? And that's exactly what we talked about, because one of the problems with Obamacare is it puts into the same risk pool very sick people and healthy people. And it requires that the healthy people pay the same price for insurance as the sick people. But on average, 5% of the population uses 50% of the health care. It's very skewed, so that a sick person uses on average 10 times as much as a healthy person. And when you make the healthy people pay the same price, they say, oh, it's like trying to feed a chihuahua on a Great Dane on the same budget.
But sick people aren't the enemy.
They're not the enemy, but we want to pay for them with tax dollars instead of foisting the cost.
The issue here is whether or not people who have pre-existing conditions, and probably a quarter of the people have some form of pre-existing condition, that in the past, back before Obamacare, the insurance companies would charge more to those individuals or they would deny them insurance coverage. That's why we created in the marketplace under Obamacare a broadly based policy that covered all 10 essential elements that needed to be in a comprehensive insurance policy. And the idea was essentially to build an insurance pool that represented the range of risk of people. The law actually said
it's a big ripoff for the young, and that's why they're not buying it, because they know that they shouldn't be paying 10 times what their own health care needs are.
What about the insurance companies? They're a monopoly, and look how the rates have skyrocketed.
They have, because of this. It's the single biggest reason that premiums have doubled since the end of 2013 is this rule that everybody sick and healthy have to pay the same. The healthy refused. They said, this is a raw deal for us.
Jim, you got to learn. Right? We're debating with Betsy. You got to jump in on this.
The Republicans want to pay for the sick people, fully pay for their insurance plans, but pay for it with tax dollars so it's spread across the whole nation instead of victimizing the small number of people, young people who are in the individual market. They can't afford it.
No, let's go to Jim.
This isn't about the Republicans trying to spend more money on the health care system. Let's go back and remember the reason we have health insurance is to cover people who occasionally have illness or who have serious illness. We try to create a pool. It's why we have employer-sponsored coverage where people with their employer can represent a broad distribution of risk. There is no point in having the health insurance industry sell insurance to healthy people. That may make a good buck for the insurance industry, but it's not the reason we have health insurance coverage.
It's exactly. The point is that once you're very sick, your costs are predictable. And instead of going into an insurance pool, the state should be able to fully cover the costs of your care so that young, healthy people can buy insurance at affordable rates. And that's what they did before.
And this idea is called a high-risk pool. And what it says is we're going to segment out those people. And remember, we're not talking 5%. We're talking anybody who has a cancer, who has mental illness, who may have a substance abuse problem.
According to the House Energy Committee, under Henry Waxman, it's 5%. 500,000 people were covered under the state high-risk pools and the federal high-risk pool. That was the number total who needed coverage before Obamacare.
And the state high-risk pool is going to put all of those people, each of the states is going to run a pool for the most expensive people at the same time that Washington is cutting back money on the Medicaid program, and at the same time...
We've already figured out what it's going to cost, and the fact is it's a fairer way to care for the sick without imposing the burden on young people who can't afford their coverage. My son-in-law has a $6,000 deductible. He said, Mom, I can't afford to go to the... I'm never going to meet that deductible.
I think the important thing to understand, I mean, we hear all the figures, the statistics here. How will it affect those people out here watching right now, our viewers, all those others who have insurance, didn't have insurance prior to Obamacare?
They'll see their premiums go way down. That's the key here. We want the premiums to drop because, as Jim said, some people are subsidized, but if you make more than $46,000, you don't get any subsidy, and it's not affordable insurance anymore.
There's two things that are going to happen under the repeal. And first, I think we would understand this is a big deal. The Congressional Budget Office said 20 million people lose coverage in the first year.
Totally phony number. I'll tell you why it's phony.
Well,
Let me just stop right there. The Congressional Budget Office analyzed what would happen if Congress repealed the law but didn't replace it. That's like saying to a surgeon, what's going to happen to your patient when you remove his heart but don't give him a transplant?
I've got to get to this before, the time we have left. I want to talk about, I know you spoke to the president and you've read all 2,700 pages. He hasn't, I guess. But what recommendations are made? Right now, what he's done, the executive order is a stopgap while they look for a replacement of Obamacare.
Because he did that executive order and because he actually sent the signal that people may not have to pay the penalty that's built into the Internal Revenue Act, the clock is now ticking. And this idea that there's somehow going to be a repeal vote and then followed by some sort of replacement, this is a big deal.
Is there anything that can...
Let me assure viewers that it's going to happen, even if the laws aren't passed simultaneously, the effective date for repeal and replacement will be the same.
Is there anything you can see in there, Jim, for replacement? Any portions of Obamacare that you see can be replaced?
All that I would say is...
It is flawed, isn't it? There are portions...
I think adjustments can be made. There may need to be adjustments in the subsidy. There may need to be adjustments in the way in which the rates are calculated. But working with it, not essentially saying that we're going to come up to the 2018 cycle and say that people don't have to pay the penalty or buy coverage. The insurance companies are going to pull away from the market. So the Congress is going to have to act here. The first thing I hope it does is it looks at the Medicaid program, which is a fundamental core of this Obamacare expansion.
Medicare is not going anywhere.
Well, Medicare is going to be changed into a block grant under this proposal. And it's the reason that Governor Cuomo pointed out that in New York, we're exposed for 2.7 million people losing insurance coverage if this is repealed.
They're not going to lose it.
I think that's an important question. Are the folks who are currently insured now, under Obamacare, are they going to lose their insurance?
They're not going to lose their coverage. And by the way, block granting Medicaid to the states will ensure that the care is delivered more effectively. Because right now, Medicaid spending is soaring. But the studies show that we're not seeing enough improvement in the health care.
Medicaid spending in New York isn't soaring at all.
I'm talking about the national numbers.
It's been under a cap for all of the years of the Cuomo administration.
We want better outcomes. We want to see improvement in health.
Let me ask you this.
Yes.
Since we're getting a wrap, give you both a couple of seconds. Just give me a final thought.
If it's a good plan, you shouldn't have to coerce people and penalize them when they don't buy it. And that's the #1 issue. No more penalties. If you provide a good plan and it's affordable, people will want to buy it.
You ought to have a comprehensive insurance policy. You shouldn't get a stripped-down catastrophic policy that then says you pay for it out of your own dollars in a health savings account. That's one of the proposals.
Washington knows best, but they don't really.
And you shouldn't cut the state's reimbursement under the Medicaid program. That is a big deal, a multi-billion-dollar deal for New York, which could blow up our budget discussions.
I think as our viewers got the idea that this debate is not going anywhere. It's going to continue for a while, and it's going to be a while before we see any kind of changes.
I think it's going to come very quickly by the 2018 cycle because Donald Trump has promised people lower premiums.
I think we will agree that the clock is ticking.
Yes.
If you're going to start to repeal this legislation, then you've got to lay out what else is. This is really one of the biggest things that's happened in American health care. You just can't make it go away and then think you'll get an agreement on how to replace it. I would keep the Affordable Care Act and work with it to make it better.
James Allen, Betsy McCoy.
Let's debate again.
I love that, Betsy.
I'm sure we'll have another program talking about this.